Hey guys, I wanted to make this video to just kind of give some people some ideas of how chemotherapy might affect them. Everyone has a very different individual response. A lot of people have somewhat similar responses, maybe a few things in common, but I just wanted to give you my idea because before I got on chemotherapy, I didn't know what to expect. I thought I would be very, very sick. And I mean, inside, it's making me very sick. It's very toxic to your body. It's extremely um, dangerous. It's extremely poisonous. It's toxic to many of your organs. It can cause cancer. There's a lot of different things it can do. Um, Now, having said that, I don't want you to shy away from being on chemo because if your doctor says that that is what they recommend or the standard procedure for your cancer, you have to do it. I'm honestly telling you, you have to do it because, I mean, you can get second, third, fourth, fifth, um, different uh, recommendations from other doctors or oncologists. But what's standard is standard. So for mine, I was given ABVD. It's adriamycin, bleomycin, vinblastine, and dacarbazine. So the first two, especially adriamycin and bleomycin, are very toxic. A lot more toxic than the other ones. The other ones are obviously dangerous, but adriamycin is a very strong, it's an anthracycline, they call it. It's a very strong anti-cancer drug. Having said that, I mean, it's strong, so it's helpful at killing your cancer. Um, Probably a lot more than the other ones, but it does come with more risks. So for me, I've had a lot of what seemed to be um, they called heart palpitations in the past. So I never figured out what it was. I got ECGs and everything. They've done an ultrasound on my heart and a bunch of things. And it seems valvular wise that my heart is pretty healthy. And that's what I was wondering if this would possibly cause me heart issues because adriamycin can damage the heart even years to decades after your treatment, depending on your lifetime dose. My lifetime dose would be I'm on four cycles, which means 4 months and 8 treatments, one treatment every 2 weeks. So I will be roughly, they give me 12 units, I guess 12 milligrams per something, or sorry, 20. And my lifetime dose is somewhere around 450 or something. At which point, if you take any more than that, then you're really running a higher risk of getting really sick. So for me, I'm young. I'm pretty healthy. I've lost a fair amount of weight, more muscle than anything, because I haven't exercised because of cancer. Because my tumor is mediastinal, so it's in the tendril of lymph nodes in front of my lungs, or kind of wedged into one of the the lobes, like the central lobe maybe, and it was pressing against my lung. It was probably like around that big. It was 6 by 7 centimeters. So the size wasn't trivial. It was a large tumor. But my stage is not 2A, sorry, it's 2, stage 2. No, 2A, yeah. My stage is 2A. It's localized. I don't know what the A technically means, but maybe it's due to the size or something, or maybe a few different nodes within the same branch. But the standard protocol for mine is always chemotherapy. Unless you can't take chemo, then they might do radiation or something. But radiation depends on the location of it as well, in terms of its possible side effects and um, you know, issues that you can come across. So anyway, I just wanted to let you know, my weight hasn't fluctuated all that much. I'm on my second, this is almost a month in. So I just took my second dose. So that's month 2, which means that I'm on the 16th day rather. I took it, day 1 was my first dose, and then day 15 was my second dose. So the idea is I can take my drugs, my chemotherapy, it circulates throughout your system through about 2 to 3 days, more so 2 days, like 48 hours, maybe a little longer, maybe a little less for certain drugs, roughly around there. So that's when your body is toxic. So you cannot share body fluids or whatever that may be with other people, because you could make them sick. Not 100% sure about saliva, but to be on the safe side, just don't be in contact with other people physically. You can be somewhat around them if they're, a significant other or your family, close people. You can go to work, wear a mask if you're around a bunch of people, because you will be severely immunocompromised. This essentially wipes out your whole immune system, as your immune system, your lymphatic system, is a quick producer of cells. The cells rapidly grow, just as other certain things in your body, like your digestive system, your hair follicles, some of the other organs. I think, maybe your kidneys and liver, but I'm not 100% sure. Maybe not. But essentially anything fast dividing will be damaged severely, because cancers are fast dividing. So that's why they call it cytotoxic chemicals. So anyway, it's cytosis, the production of the division of cells. So fast division of cells, those kind of things are usually the ones that are damaged. So let me start with day 1. So they will give you, depends on route administration. The first time they administrated it is through the vein here. And then yesterday they actually tried to do it here, but they weren't successful at it. Maybe they poked through the vein and they failed. So they took it out, obviously before administration, thank God, because some of the drugs can be necrotic to your tissues. So they put it through the arm, or the wrist, the bottom of it. So that was successful. So for me, you can tell my body, like I said, it's very individual dependent. My body, I've been pissing a lot. I pee a lot. I typically do, but because of the drugs, I would say I pee more. It seems as though my body just tries to get rid of things that are toxic right away. If I drink alcohol, I pee a lot because it's just trying to get rid of it. And so it seems the same situation with this. If I drink a lot of water, not even if I drink a lot of water, like the first night, I peed like 7-8 times throughout the night. I'm not even kidding. And it can be a struggle trying to get to sleep the first few nights for sure because of that, but also because of the steroid that they, I think some of the anti-nausea medication they give you are somewhat steroids, but they give you corticosteroid through your vein to prevent damage or side effects, particularly lung toxicity, pulmonary fibrosis from the bleomycin that they give you. So going back to my lifetime maximum dose, pardon me, I didn't finish what I was saying. Because I'm getting 8 cycles, I'll probably get around 160 units of adriamycin, the most dangerous but the most helpful cancer curing, I suppose you could say, drug in my regimen. So 160 units is what I'll be giving. Hopefully it'll be enough. And my lifetime maximum is 450. So I'm feeling quite confident that I can do this without much issue. Sorry, I just have to cancel a call there. So the first day, people can notice in me that I get very pale right as they administer these drugs. So the reason why you might be getting pale is, you might not be, dying on the side or anything like that. So don't panic too much, especially if you're not feeling pain at the time. But because it circulates through IV, through your bloodstream, it goes through your organs right away. And so because it damages your production of red blood cells, you're not getting the oxygen that your tissues need right away. I mean, you are to an extent, but less. So therefore, yeah, I mean, I have light skin, so I just go pale white. I get real white. Some people, if you have dark skin, you might have like grayish, maybe somewhat dull skin, or you might even go slightly darker. You'll know how you're affected generally if you go faint or whatever, or if you if you just have that reduction of oxygen. Some people know just how their skin turns. For me, so they give you a nausea medication called Akynzeo. So Akynzeo it lasts for 5 days. It's one pill, and hopefully you'll have it covered, because it's like here in Canada it's $180 per pill. It's a lot, but without it, this would be very hard to go through, honestly. So I'm on Akynzeo, dexamethasone, and then this other one. Anyway, they'll go through it, but take the Akynzeo and all the nausea medication you need. They will give you direction as to when you should take it. You'll be taking it right prior to chemo, and then for about 3-4 days after. Make sure you take the laxatives that they suggest. Take the laxatives, drink lots of water, try to eat. I mean, some people have different just because you will get constipated from those drugs. You will. I did in the end of it for 2 days, and luckily it just dissipated. The drugs dissipated in the 5th day, and then I had a stool, and then that was good. So I didn't have to take the drugs anymore. But if you take something called Restorelax, it's a polyethylene glycol. It kind of assists your digestive system to kind of bring everything down. If that seems to be not working, the 17 grams a day, double it up. And then if that doesn't work, you're gonna have to take synicides. I forgot what the name is. Anyway, synicides is the kind of laxative you want to double up with your PEG, your polyethylene glycol, and then hopefully that will work. But like I said, if you have any issues with laxatives, or any issues with blockage, and 3 days is usually you want to really, go to the hospital and get it figured out. Do something. They can give you an enema even. I mean, I didn't do mine, but that's because I finally had bowel movement after 56 hours or so. So that's really important. You don't want to get an infection, any kind of infection. You're already very immunocompromised, as previously stated, so you don't want to get an infection. Drink lots of water, eat lots of food. Try not to have too fibrous food, because fiber is not going to actually help. It's going to help create blockages in your system for at least the couple of days that you're taking nausea meds. Not because of the nausea meds necessarily that cause these blockages, but it's the fact that your digestive system is wrecked after. It just damages so many of the cells in your digestive system. You have to recreate or replenish the good bacteria in your system. So very important. Eat healthy. Don't have any spicy food or anything. Just don't. You could. I did later on, but it's good to not to prevent mouth sores, which can happen from chemotherapy. That can lead to possible infections. So if you do get mouth sores, I have kind of like a sore throat in the back on the right side, and so I don't think I'm sick, but that might be associated with sores of the head, neck, and throat area. So I gargle with salt water once in a while. You can add that up with you can add that up with baking soda if you want, just a little bit, maybe a half teaspoon each in a warm cup of water. Like I said, no hot liquids, please, no hot liquids. You want to make sure it's like somewhat lukewarm. Keep it very homeostatic when it comes to anything that's going down the throat. Make sure that you really don't irritate things, because irritation can really cause you grief, and you don't want to cause anything that may increase the risk of an infection once again. So for me, I eat. I'm able to eat. I'm sorry for taking a long time to get to this, but I wanted to get through some of the things you want to make sure you do to protect yourself during these tough times, because chemo's not easy, guys. But you can get through it, honestly. I ate. I was still hungry. I didn't personally get any weird taste differences, so I was able to have normal tasting food. No weird metallic tastes or whatever, but some people might differ. The first night is tough to sleep because of the steroid that they give you, and then the nights after are a little bit easier. But yeah, you will feel a little bit nauseous, maybe just like a premonition of nauseousness and kind of in the background. A little bit hazy, you might get lightheaded if you get up. Don't be too surprised. You will feel a bit weak. Like I don't feel like exercising right now. I have exercised hardcore for my whole life, and right now I was waiting till my lung was cleared up so that I would able to breathe when my tumor's not pressing down on my lung, right? Which is getting better. That's one thing I wanted to say, is that I've after 3-4 days you start feeling a bit better. You might feel extra tired because the lymphatic system kind of takes some days to really kind of it's like a lag effect. So maybe like the 4th, 5th to 6th day, you might be real low in terms of your immunity. So wear a mask when you need to, for sure. What I really want to kind of harp is, you want to take this route. You want to take the the medical route. People say it's dangerous. Yeah, it is dangerous, but it's a lot less dangerous than letting this cancer slowly make you more sick. And you can get treated if you're at stage 4, but why bother? Why not get treated at stage 2? Why not get treated at stage 1 if you get even? So you don't want a situation where you think you can get through this naturally without chemo or without radiation, without immunotherapy, without anything that has cold hard facts. Chemotherapy works for this cancer more than 90% of the time. It can cure your cancer. Mind you, it can come back. I'm saying cure in terms of it will be technically gone. The cancer will be out of your system. So then they can have a monitoring regime where they make sure that it doesn't come back. Less than 20% of people that have it gone ends up coming back, and I would presume that those people actually still had cancer in there, but they didn't know 100% for sure. So I need to think of if there's anything else I need to kind of go over. Yeah, don't share a washroom with people. Your body fluids, and including your excretions, can be toxic. Sex, just avoid it for at least 3-4 days, so that you don't have residual toxins in your body, and then you can wear condoms or whatever after. Just talk to your doctor. But in terms of side effects, I mainly get through it after 3-4 days, and I start feeling myself again. So I'm 25% of the way through. This is essentially when I feel all of my my nausea a bit and weaknesses, tired, all that stuff. Get moving. Please get moving. If you can, walk. Get out there. I mean, cover your head with a hat if there's sun. Chemo can make you very, very susceptible to sun damage. So just, wear a hat or whatever, put sunscreen on, stay out of the sun, but get your walks in. Do something. It doesn't have to be hardcore anything. Just walk and walk and walk, because the more you move your body, the more you can get this drugs out of your tissues and out of your body mainly, and then circulate it, along with drinking a lot of water. But also it can help you start having stools, because you're literally, if your digestive system is not using its contractile motions to move things past in your digestive system, your movements will force it. It's kind of like your movements force your veins to push blood back to your heart, literally, because they don't have contractile motion. They just have valves. But to prevent it from going back, but to move, you can actually create artificially those movements to kind of move things along in the digestive system to get rid of it. So very important. Like I talked about that a lot here, but very important, let me tell you. And I want to, I know might be a different regime that you're having, but this is what I'm dealing with. And if you have had lymphoma, or Hodgkin's lymphoma particularly, if you have this, please, take my advice, or at least consider it. And other people with chemo, maybe you'll have somewhat similar symptoms that I dealt with, and maybe you will have some kind of help from what I'm saying, because cancer is very common. It's always been common, but the thing is, we didn't really have as much of a surefire way of doing proper biopsies, maybe, and the biopsies were not as robust, maybe, and people didn't even do biopsies sometimes, so people just died and said, well, maybe they had cancer, maybe they didn't. But what I mean is, nowadays we have ways that are pretty surefire that, if you have cancer, you have cancer, and they know what kind you have. So the monitoring of cancer and the it's a lot more efficient, and we know essentially without reasonable doubt that someone does or someone doesn't have cancer. We can find it out easier. So people have had cancer a lot in the past. People still do have cancer. It will only go up in terms of the rates of cancer. A lot of young people get Hodgkin's lymphoma. A lot of young people. I'm not saying that it's a rare cancer still, but people that do get Hodgkin's lymphoma typically are young, and typically they can be old, like older than 70 or 80, but they can also be 16, 19, 28 in my situation. You can be healthy. You can be really healthy and still have it. They say that it comes from Epstein-Barr virus, which you can look it up yourself, but it just happens. So arm yourself with this material, please. If you do have cancer, or any kind of cancer, maybe you can get something from this, because a lot of the adriamycin, the anthracycline I was talking about, is in many different cancer regimens. So I'm hoping this helps some of you people, and there's more to talk about, I'm sure, but you can always just leave me a comment if you need. And share your story. Don't be afraid to share your story. This works. I'm telling you right now, I can feel my lung being cleared up. I'm not coughing up blood anymore, really. I can expand my lungs more than I was, when I wasn't treated. The tumor is shrinking. I haven't had my PET scan to see how my progress is, but my tumor is shrinking. So you can do it. You can. Just keep your head up, and you can do well. I promise you. It's going to be hard, but life isn't supposed to be easy. So thanks for watching. Have a good one.